Yeah, so as Johanna said, my name is Shewhat Ghezai, and I'm a psychiatric nurse. I work at an emergency psychiatric ward at a hospital in Oslo, Norway. I'll just... So I'm just going to give you an introduction to mental health, a short introduction and the topics that both Fiona and Dr. Tesfaye are going to talk more about. These are the topics that I'm going to highlight during this session. Yes, let's just start. So what is mental health? WHO defined mental health as the state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses in life, can work productively, and is able to make a contribution to his or her community. So this tells us that mental health is constant. It's something that's not defined by an illness or a disease. It's something that's fundamental to us as humans and individuals. It affects how we think, how we interact, how we react to everything that meets us in life, and our level of motivation and our outlook on life. There's so many things that can affect our mental health, and it's always growing and evolving. For example, in our childhood, there's so many things, and developing years, there's so many things that are essential, and especially like how we're met. So for example, a mother and how a mother comforts her baby is going to tell us or learn us something about how people are going to react to our behavior and how our behavior can affect others. So this is just an example from you're born, you're always evolving and working on your mental health. When we're speaking about mental health, I think it's essential to talk about feelings. So our feelings, and it's a really big part of our mental health. Our feelings are fundamental to the way we exist. So, and it's essential on us as species and also as individuals. Our feelings tells us, they're usually based or attached to a need. So your feelings are telling you something about what you need. So again, as babies, you're born with feelings. A baby is born with a feeling ability to feel happy, to feel sad, to feel angry. But everything else, the way you communicate it or what you do about it is taught later in life. Our feeling notify us when there's your need needs to be served to. So, and when you're feeling something, your body reacts and send you like a physical alarm. You can call it a notification. So for example, if you're exposed to an open flame, or your hand is exposed to an open flame, you're going to feel pain. And the physical alarm or the notification is going to make you react accordingly and help you away from that situation. And in the same way, you can say that when your body is experiencing a threat, you're going to feel fear, and your body is going to react to that accordingly with what we call a fight or flight mode, or a reaction. So we can all agree that feelings play a big part in our lives, and how we survive. Actually, everything that you do, if you're going to eat or you're going to sleep, they're based on needs. Another part that's really important to talk about when we're talking about mental health, I think, is stress, something that everyone can relate to. Stress occurs when a person experiences demands and expectations from their surroundings that exceeds their own capacity. And I think this is a feeling that everyone can relate to. This is something that Dr. Tesfaye is going to talk more about later, the psychological stress and clinically being stressed, but I'm going to talk about it as stress or something that we're we're affected with every day of our lives. Being stressed over a longer period of time can affect your long-term emotional and psychological reaction. And in time, it can increase your vulnerability to both anxiety disorders, depression, and other mental illnesses. So an example of a long-lasting stress could be, for example, taking care of a sick person, someone that you love. It could also be a reoccurring, it could be both time-defined, and it can also be reoccurring trauma, for example. So it could be someone that has experienced sexual abuse, or it could be someone that has war memories. When we're talking about stress in this type, like a trauma, we're saying that the way that you're reliving it, and it keeps being experienced as overwhelming after the time period, even though the period is done. So this, after a longer period of time, this can make us more vulnerable for other diseases. A person that is stressed over a longer period of time can change their behavior to like a coping mechanism. So the signs that can be shown is a change in physical activity, either more or less. It could be a change in habits, like increasing or starting to smoke when you've never smoked before, or increased alcohol abuse, or another thing is a decrease in self-care. You've probably heard that you can tell how someone is doing by seeing how their home looks. So is everything clean? Is everything neat? Are they taking care of themselves? Are they eating at the right time? If not, it could be a situation or a person that are experiencing stress over a longer period of time. There's a study that showed 50 to 80% of people with depression reported a major life event before the depression started. So based on this study also estimated that 20 to 25% of people that have experienced a major stressful life event will develop a depression. By this, I'm not saying that everyone that has experienced stress is going to develop a mental illness, but this tells us something about how serious we have to look at it and how we're going to cope with the stress that we're experiencing. Another term than stress that people usually use a term is being worn out. I guess everyone has felt that feeling sometimes, being worn out. So that means that you're being stressed over a longer period of time, that the high level of expectations to you exceeds your capacity. The result of this could feel some type of guilt. So a lot of people could feel, if it's stress about school, for example, that these are the assignments that they're giving me. This is something that I should be able to do since they're giving it to me. So you could feel ashamed because you're not able to handle it. You can feel shame, and you can feel guilt, and you can feel not like hopelessness, not like that you're not good enough or doing good enough. And these are symptoms or signs or feelings that also often occurs when we're talking about depression and anxiety. So that leads me to the next topic, depression. It could be also, it's a mood or feeling, and can also be a clinically diagnosis. So according to WHO, 264 million people in the world are affected or have depression, the diagnosis. The diagnosis is characterized by lowered mood, psychomotorical inhibition, like you can, both your body and your mind is slower than it usually is. So the way you speak, the way you think, the efficiency of you being you could be slower than normal. It's also common to experience low self-esteem, like I said before. Why am I not good enough? Why am I not well enough? why can't I do this? Like I was saying about stress. Many also have told that they experience physical pain. And this is maybe common to many people, but you attach the feeling or how you're doing mentally to how you're doing physically. Especially kids do this. They tell us that if they're stressed, they have a tummy ache, they have a headache, they're tired, they're hungry, but it could be more behind it. To set the diagnosis far from the mood. So I said the mood is a depressive mood, like a lower view of life. But to set the actual diagnosis, you have to have at least 2 of the 3 symptoms that we call the basic symptoms for the diagnosis, and that is the lower mood, as I said, lack of interest or joy in life that you use of things that you used to view as joyful, or reduced energy. There are a lot of more symptoms that you could have with depression, but they just tell you the grade of your depression, of the diagnosis. I'm not saying that this is a tool that anyone should use at home to diagnose themselves, but if you have 1 and 2 or more of these symptoms for a longer period of 2 weeks, you should seek professional help. People that are vulnerable for mental illness, like depression, may be triggered by events in your social life. So this is what we call a crisis within the field. So it could be a crisis for me, could be something else than a crisis for you. If I'm vulnerable for the disease or for the illness, I can react, or a crisis could occur if there's a major life event. So a change in my social status, if it's a breakup, if it's a change in your job, like a career change, this could really affect you and trigger a depression. So these are things that you have to be careful and think about. Just to give you an idea of how many this really affects, around 20% of all women and 10% of all men will experience depressive periods during their life, while 5% will have chronic mild depressive bothers throughout their life. And this is especially for Norway. I'm not sure if this is for all of the world, but at any given time, around 5% of the population are having depressive bothers that inhibits their function in their daily life. So, and this is the group that I was talking about that actually need help, but only half of them actually get help. I'm going to talk about some theories of why this is happening and why not everyone is getting help, and the way we talk about it and everything. But this is just to give you an idea of how many people are affected by depression, not only the mood, but the diagnosis. Like I said earlier, when I was talking about stress, a lot of the symptoms are similar between depression and anxiety. They all usually go hand in hand. People with depression could have symptoms that are similar to anxiety and vice versa. I'm going to talk a little bit about anxiety. Yeah, these are some of the symptoms that you can experience with depressions. Like I said, it varies in different grades from severe to mild. Yeah. So anxiety is actually a defense, or is based on a defense mechanism. So it's said to be the mind and body's reaction to a stressful, dangerous, or unfamiliar situation. So evolutionary, this is a way of our body it's based on making our body react, like I said, with feelings, our needs. Like I said, if you're feeling pain, you have to react. If you're feeling fear or threat, you have to react. But when what your body is interpreting as a threat, if there's actually not a threat, not a reasonable threat, it's considered as anxiety. So when it mismatches. So when this misinterpretation is so severe that it actually inhibits you in your daily life, that's what we call anxiety. And that could give both mental and physical activation. By activation, we just mean reactions or symptoms. According to WHO, in 2015, the total estimated number of people living with anxiety was 264 million. That's 3.6% of the population. And for someone that has never experienced anxiety, it could be very difficult to understand or to comprehend. We have a lot of subcategories under anxiety, or the diagnosis of anxiety disorder, but I'm going to use one, and it's a phobia for public spaces, which is pretty common, but pretty severe too, because it threatens you in your daily life to that extent that it's actually going to stop you from doing normal things, from living your life. For most people, big crowds and open spaces do not show any threat, and it shouldn't be any threat. But for a person that are suffering from anxiety or phobia for open spaces, it's going to stop them from actually doing it. Their body is thinking or interpreting it as it's a big threat, an actually life or death situation. So, like I said, this stems from like evolutionary. It stems way back before us. So, your body, the part of your brain that thinks rationally and that is logical, and that takes too much time. So that part of your brain is just disconnected. You need to act to survive in this situation. You need to act immediately to survive. So this is for your own good. So the part of logic, the part where you're saying that there's actually no threat here, no one's threatening me, there's a lot of other people here, and this is a mall, it shouldn't be a problem. That part is just disconnected. You're just reacting. This is an example of people that are living with anxiety. So they could experience, I think I have the symptoms here. Yeah, they could increase, and they get an increase in heartbeat, rapid breathing. A lot of people say that panic attacks or the attacks of anxiety are they're thinking that they're experiencing an asthma attack, because it's kind of the same feeling. It feels like it's physical, but it's actually emotional. They can get muscle tension, like I said, the fight or flight reaction. You could either just tense up like this, or you can just act out, so the fight or flight. You can experience sweating, shivering, trouble breathing, feeling faint, nausea, numbness, dizziness, and even a lot of people have said that they need to use the bathroom in different ways. So your body just reacts and is acting on its own. I've had patients that said they wanted to explain how it felt in that moment when we were talking about it, when the moment had passed. And one said that he was experiencing flame in his stomach. And the physical pain, he said it would be better to actually stick his hand through a flame, because that would be less hurtful than the pain that he was feeling in his stomach, and he couldn't rationalize it. He couldn't talk himself out of it. Side note, it is possible to work with, and people with anxiety don't have to live with it forever, but it's something that you have to do methodically. It's not, in that situation, you're not able to. That's why it's an illness or a diagnosis. Now I've talked about like the different topics that both Fiona and Dr. Tesfaye are going to talk more about. But I think when we're talking about mental health and bringing light to it, to talk more about it, we also have to talk about stigma. The way that we yeah, this is the example that I used. The way that we view and talk about stigma. So one of the definitions that I found about stigma was to stigmatize involves giving an individual or a group a negative trait on the basis of one characteristic, like a stigma or a mark. This affects the way we think about mental health, and also the way we talk about mental health. The way that we talk about mental health is going to set a precedence on how we are going to talk about our mental health. So if we're going to talk about mental health in a negative manner, or mental illnesses, that's going to set precedence not only for us, our well-being, but people around us, about how they view or how they're comfortable talking about it. That means that if, for example, in media, a lot of people, or if there's been a crime, or if there's been a person that's done anything and a mental illness is involved, they would probably say that. And that would give people a reason to, that sets precedence. So they attach that negative way of talking about people with mental illness to that colors the way that they're thinking. We have to, I think also that a lot of people, this is known, that a lot of people feel that they're like if they're vulnerable or showing emotions or talking about their feelings, that they're weak. And I'm going to show you, give an example. Also, they're comparing themselves to other people or other people's problems. So I'm going to show an example. This is not, I have not researched any of this, but we've talked about it. I've talked about it with several people. And one theory is for us, for Eritreans that are living in the diaspora that didn't fight in the liberation fight, they're comparing themselves, our daily struggles, compared to like our people, the generation before this, they fought a tangible fight. It was a fight that you could show to, you can show examples. Everyone could relate to it. Everyone was knowing it. So if you were feeling something, you could express that with everyone around you, and you would be understood. This, and then the generation under, like our generation, are now, when they're experiencing a problem or a feeling or something that they're not mastering, so a moment of stress, whatever it may be, maybe they compare themselves, we're comparing ourselves, comparing, is this problem, okay, so I'm feeling stressed out about school and all the assignments that I'm getting at school, but is that really a problem? Is that big enough for me? Should I be complaining about that? I'm lucky enough to go to school. I'm lucky enough to have that opportunity. And like I said earlier, the assignment was given to me, so maybe I should be able to deal with it. And then you compare yourself and what other people are going through, or is it worth mentioning? Is it even a big enough problem? But my thought is, the one does not have to exclude the other. I'm not saying that other people's problem are not big enough, but why does it have to be either there or mine? Can't we all, it's how I am experiencing it. And we also know that our brain is like a what is it called? Like a tea boiler, like the kettle. So if you don't let out steam once in a while, it's gonna explode or say doot after a while, right? So our brain is the same way. If we don't talk about our emotions and all the waves that follows with our emotions, even how big it is or how small it is or how serious other people think, it's going to get worse if you don't talk about it. A lot of people feel shame and embarrassment in this. One when we're talking about stigma too, we also have to talk about culture. It plays a big part on how we view mental health and how we relate to it, the same way as stigma. Culture could be defined as the customary beliefs, social forms, and material traits of a group, the set of shared attitudes, values, goals, and practices that characterizes an institution or organization. I think a lot of people forget that you could have culture in every group. That means your friends. It could be your friends from kindergarten and your friends from university, your workplace, your family, your country. That's the most common that people think about, or a region in the world. But within a country, you could also have culture within a religious group, or I even have different cultures in different groups that I'm with. So we have to think about that. So culture is how we as a set group think collectively about something. A lot of people think that they're independent and my views are not to be affected by this and this, and my views are based on my values and my beliefs. But it could also, in many cases, they're affected by people around us and the culture that we've created together. So when we're talking, this was just about culture, but how we talk about mental health really affects us. So if we're gonna change or do something about the culture, we have to talk about it as a collective. For example, in different parts of the world, it's more normal to seek religious leaders when you're feeling different feelings, or it could be something that you would in other parts of the world would describe as a mental illness. Yeah, it also affects how we relate to things and describe things. So if I feel that it's a culture in our group to talk about feeling sad, it's going to affect how I view myself or identify that feeling when I'm feeling sad. But if in my group it's not a culture to talk about that, I'm not going to acknowledge that feeling or work on that feeling or talk about that feeling. I hope everyone thinks about this, or this sets, so you can, because I think it plays a big role. So I wanted, this is a slide about barriers when talking about mental health, from 2015 from WHO. And it says that this is for depressive illnesses. You can see that 322 million people were affected in 2015. 9% of these was in Africa, and then 27 of these were in Southeast Asia region. And this just has me thinking, is it actually more of it in Southeast Asia, or is it the way that we're dealing with it or talking about it? Are we actually viewing mental health in the same way all over the world, or has our culture and stigma affected us and how we seek help? Are these actually true numbers or not? This is just a thought that I would have. Another thing that I want to emphasize is, to talk about mental health, we need to have a language to talk about mental health. When I say language, I don't only mean English or Norwegian or Tigrinya or Arabic. I'm talking about knowing the words or knowing the feelings and what word that is attached to it. I had a patient once that told me she had went to therapy for I think almost 10 years. And it was only the last couple of years that she actually benefited from it. She probably got something from it and she could work it, but fully benefit from it the last couple of years, because when she was asked questions, how did that make you feel, or what did you feel, or could you identify that feeling, she didn't know the word for it. So she just replied what she thought was expected from her. And she didn't actually know. This could sound pretty abstract for some people or difficult to follow, but to give an example, or I'm going to use colors. You only know that the color blue is named blue because you were taught it, not because you knew it when you saw it the first time. So you saw the color blue, someone told you that this is named blue, and that's why you call it blue this day today. So imagine if you went to therapy 30 years old and someone asked you, what color did that awaken inside you? And you didn't know the name of the color, you wouldn't benefit from it. So the reason why I want to talk about this is, or emphasize this, is we need to work on the way we view our feelings, the way we talk about our feelings, and we need to systemize it for ourselves. I've worked in this field for 7 years, and I still don't have all the answers for my feelings, but it's a constant progress. We need to talk about it with people around us. We need to identify it for ourselves, and we have to have a conscious point of view when we talk and think about mental health. This is, I think I'm going to finish with that. Thank you for your attention.